If you're not used to it, you can just go like that. That's called the health bounce. But as you get better at it, I'm not going to jump really, really high, but you get better at it. You get kids, have you seen what kids will do on this? You know, at first, kids are a little bit out of balance, and you might be a little bit out of balance, but the more you do it, the better your balance will be. You can also start by this, just going like that. But this little one's called the health bounce. But when you start jumping, when you're to the height of your jump, every gate opens. And when you hit the mat again, every gate closes. Isn't that incredible? If someone has no feeling in their feet, or they have peripheral neuropathy, or if someone continually has cold feet, perfect health requires perfect circulation. And perfect circulation means your feet and your hands are warm. So what you do if someone has cold feet, you cannot do this treatment to them. Because if they have continually cold feet and you put the cold feet in hot water, you can damage the tissues. But you can do what I'm about to show you, which is a olive oil and cayenne pepper compress. Now what I've got is I've got cling wrap down there, and I've got a double layer of kitchen paper. And I'm going to sprinkle it with a little bit of olive oil. You could use castor oil if you like, but olive oil will suffice. And you spread it over the area, because what you want to do is put enough olive oil on there so that the cayenne pepper will stick to it.
Dr. Barbara O'Neill has been banned. Yes, while she is banned from practicing in her home country of Australia, the rest of the world embraces her, cherishes her lectures, and respects her profound knowledge, which often surpasses conventional treatments. In this video, we will explore some of her natural healing techniques that seem almost miraculous. You really deserve to know this, regardless of how many powerful entities try to silence her. Dr. Barbara O'Neill advocates the use of onion compresses as a versatile and natural remedy for common ailments such as earaches, sore throats, and coughs. Onions are rich in sulfur compounds, including allicin, which are responsible for their antimicrobial and anti-inflammatory effects. These properties are central to the therapeutic benefits of onion compresses. For earaches, Dr. O'Neill highlights that the application of an onion compress near the affected ear can provide significant relief. The heat from a warm compress helps to increase blood circulation around the ear, which can diminish inflammation and promote healing. The sulfur compounds in onions have antimicrobial properties that may help in neutralizing pathogens causing the earache.
I said, what did your mother do when you were a little girl and you had an earache? She said, Mum would steam up an onion on the stove. So I went home, I steamed the onion up on the stove, and then I cut it in half. So you keep the skin on, and it keeps everything in place. The onion up in a cloth, a few layers. I tested it on my arm, and I put it on his ear. You can keep it on for as long as you can keep it warm. James slept for 2 hours. When he woke up, he was happy. I watched him all day, and the next day, and the next day. That was it. Just compare my experience, 2 hours sleep with onion on his ear, and then my last experience with my first daughter, 6 weeks and 4 courses of antibiotics. I have since learned that you can steam it and squeeze it. And if you squeeze it, you'll get a few drops of juice out. This is when it's hot, and it'll be boiling hot, but when the hot juice hits the spoon, it'll go a nice temperature, and you can put that in the ear.
To prepare the compress, finely chop an onion and gently heat it in a pan until it softens without burning. After heating, wrap the onion pieces in a clean cloth to create a compress. Place this warm compress around the outer ear, ensuring it does not come into direct contact with the skin to prevent burns. This treatment is believed to alleviate pain and potentially aid in drawing out infections. Now, if you have sore throats, onion compresses offer soothing benefits through their anti-inflammatory effects. When you apply a warm onion compress to the neck, it can help to relax strained throat muscles and increase local blood flow, which is beneficial for speeding up the healing process. The sulfur compounds in onions are thought to inhibit the growth of bacteria. That way, it reduces the intensity of throat inflammation and discomfort. The preparation involves heating chopped onions, then wrapping them in a cloth. Then, just place this compress on the throat for several minutes to experience its soothing effects. When dealing with coughs, onion compresses can be particularly useful due to their mucolytic and expectorant properties. Onions help in breaking down mucus and reducing respiratory congestion. To utilize this remedy, heat chopped onions until they become soft and then wrap them in a cloth. Apply the warm compress to the chest. The warmth combined with the sulfur compounds helps to ease coughing by promoting mucus clearance and soothing inflamed respiratory tissues. In Dr. O'Neill's method, the most important part is the temperature control. While using onion compresses, they should be warm but not excessively hot to prevent skin burns. Regular application of these compresses, as suggested, may provide symptomatic relief and support the body's natural healing processes for earaches, sore throats, and coughs. Apart from onion, Dr. Barbara O'Neill notes the therapeutic advantages of potato poultices for managing inflammation and infections. Potatoes, abundant in beneficial compounds, offer a natural remedy for reducing tissue inflammation, easing swelling, and drawing out infections.
Which we'll move on to now is the potato. And the potato is probably the most famous and the most powerful for all tissue inflammation. Ginger is for joint inflammation, the potato is for tissue inflammation. So where you would use your potato would be a swollen ankle, sprained ankle, any area where you've got swelling, ingrown toenail. So to make the grated potato poultice, we grate the potato. Potato is very wet, so be careful not to make it too much. Spread it out a little. This is very cooling. And this potato poultice you can use in any of the tender parts of the body. Very good on sore eyes, very good for conjunctivitis, and you can see that's quite wet.
Key active constituents in potatoes include starches, enzymes, and vitamins, which collectively contribute to their medicinal properties. The preparation of a potato poultice involves grating or mashing raw potatoes and applying the resultant paste directly to the affected area. Potatoes contain starches that serve as natural anti-inflammatories. These starches work by interacting with inflamed tissues to decrease swelling and soothe irritation. Their high water content facilitates skin hydration, which in turn aids in the absorption of the poultice's beneficial properties into the skin. Enzymes such as catecholase found in potatoes are critical in reducing inflammation. Catecholase acts by breaking down inflammatory proteins, thereby mitigating pain and promoting a faster healing response. Potatoes also provide vitamins such as vitamin C and B6, which contribute to skin health and repair, further enhancing the poultice's therapeutic effects. When applied to inflamed or swollen areas, the potato poultice utilizes the osmotic properties of its starches to draw out excess fluids from the tissue. This mechanism not only helps in reducing puffiness, but also provides relief from associated discomfort. The poultice's cooling effect can alleviate pain and provide immediate symptomatic relief from inflammation. In the context of infections, a potato poultice can be beneficial for drawing out pus and other infectious materials from wounds. Potatoes possess mild antiseptic properties that can assist in preventing secondary infections and support the overall healing process. The moist environment created by the poultice helps maintain an optimal condition for cell regeneration, reducing the likelihood of scabbing and promoting faster recovery. Dr. O'Neill recommends applying the potato poultice for a duration of 30 minutes to an hour, adjusting based on the severity of the condition. To ensure effectiveness and prevent contamination, it is important to use a fresh poultice each time. Covering the poultice with a clean cloth can help secure it in place and avoid any mess, ensuring that the therapeutic benefits are maximized. But speaking of therapeutic benefits, castor oil is an essential tool for addressing lumps, adhesions, and scar tissue. The application of castor oil, a natural vegetable oil derived from the seeds of the Ricinus communis plant, involves the use of a cloth soaked in the oil, which is then applied to the skin. Dr. O'Neill emphasizes that castor oil's primary active compound, ricinoleic acid, is crucial in this process due to its anti-inflammatory and analgesic properties.
castor oil compress. It can be used on the abdomen for constipation. It'll penetrate deep and break up congestion in there. It can help to break up gallstones in the gallbladder. It can help to revive the liver. So your liver, your gallbladder is under your right rib. So you would do it to that area. It applied to the kidneys, it can help break up kidney stones. And so there's a whole lot of areas that you can use castor oil. I don't advise you take it by mouth. It can be a little irritating there. I met a lady who was the wife of a doctor. She said, 20 years ago I had irritable bowel syndrome, and when my husband told me what he was offering medically, I said no thanks. And she'd heard about castor oil, so she applied castor oil compresses, and she said she healed herself. Little few dietary changes as well.
Ricinoleic acid works by penetrating the skin and reducing inflammation, which can facilitate the breakdown of dense tissues and fibrous adhesions. Adhesions, often a result of surgical procedures or chronic inflammation, can cause significant discomfort and restricted mobility. The application of castor oil packs helps in easing these conditions by promoting the detoxification process through increased lymphatic flow and circulation. This process helps in softening and dissolving adhesions and restoring the flexibility of affected tissues. Additionally, the heat generated from the castor oil pack enhances blood flow to the area, which further assists in the healing of underlying tissues. Dr. O'Neill also highlights the role of castor oil packs in addressing scar tissue. Scar tissue, formed as a result of injury or surgical procedures, often lacks the flexibility of normal tissue and can lead to functional impairment. Castor oil packs help in breaking down this fibrous tissue by enhancing cellular regeneration and improving collagen formation. The continuous application of the pack supports the body's natural healing processes, allowing for the gradual reduction of scar tissue density. To get proper results, Dr. O'Neill recommends applying the castor oil pack consistently over a period of several weeks. The process involves placing a layer of flannel or cotton cloth soaked in castor oil on the affected area, covering it with a plastic wrap to prevent mess, and applying heat with a heating pad for approximately 45-60 minutes. This routine not only helps in the absorption of ricinoleic acid, but also maintains a consistent thermal environment conducive to the healing process. The therapeutic benefits of castor oil packs extend beyond mere physical improvements. They can also create a state of relaxation and reduce stress, as the treatment promotes an overall sense of well-being through its calming effect on the nervous system. Dr. O'Neill's approach to using castor oil packs is grounded in its historical application and contemporary evidence supporting its efficiency in treating complex conditions related to lumps, adhesions, and scar tissue. Then we must discuss cayenne pepper. Dr. Barbara O'Neill explains that cayenne pepper can significantly boost blood circulation and support heart health. This is mainly due to its active ingredient, capsaicin, which helps improve blood flow and reduce inflammation. Capsaicin, which is responsible for the spiciness of cayenne pepper, contains notable blood vessel dilator properties. This means it helps to dilate blood vessels, improving their diameter, and consequently, increasing blood flow. An enhanced blood flow reduces the workload on the heart and lowers blood pressure, creating a more efficient cardiovascular system.
Cayenne pepper does not cause any bleeds. In fact, if cayenne pepper is going through your arteries and your veins and it finds any bleeding, it'll seal the bleeding blood vessel. How come it can thin the blood and yet seal bleeding blood vessels? Well, God said that He gave herbs for the service of man. So the cayenne pepper comes in and says, where would you like me? I'll thin this blood. Oops, I'll seal off that bleeding blood vessel. It's a powerful herb. The book Back to Eden by Jethro Kloss, he devotes half a page to every herb and he devotes 10 pages to cayenne pepper. It's a powerful herb. Cayenne pepper not only thins the blood, it strengthens the arterial wall.
As blood vessels expand, the heart can pump blood more effectively, leading to improved oxygen and nutrient delivery to various tissues and organs. Better blood flow helps keep your heart healthy by reducing stress on it and preventing problems caused by bad circulation. Capsaicin helps protect the heart by improving blood flow and preventing blood clots. It also helps stop platelets from sticking together, which lowers the chances of blocked arteries and reduces the risk of heart attacks and strokes. If that's not enough, capsaicin is good for fat breakdown and speeding up metabolism. This helps manage cholesterol levels by breaking down LDL, bad cholesterol, and lowering overall cholesterol in the blood. This keeps arteries flexible and helps prevent atherosclerosis, a condition where arteries become hardened and narrowed. Cayenne pepper is rich in antioxidants like flavonoids and vitamin C, which fight oxidative stress and inflammation. These antioxidants protect blood vessels from damage that can lead to heart disease. Additionally, cayenne pepper helps control blood sugar levels by improving insulin sensitivity, preventing large spikes in blood sugar, and supporting stable glucose levels. This is important for managing diabetes and reducing cardiovascular risk. So, as you can see, cayenne pepper's benefits include better blood flow, reduced clotting, improved cholesterol levels, antioxidant protection, and stable blood sugar, all contributing to better heart health. Now, let's move on to ginger poultices, whose therapeutic application is widely advocated by Dr. Barbara O'Neill for curing joint pain and inflammation. Ginger, a rhizome renowned for its potent anti-inflammatory properties, contains bioactive compounds such as gingerol and shogol. These compounds are key in controlling inflammation and reducing pain. Dr. O'Neill highlights that these compounds block pro-inflammatory cytokines and enzymes such as cyclooxygenase 2, COX2, which helps reduce inflammation in affected joints.
Use a ginger poultice for an inflamed joint. So the easiest way to remember this is ginger is for joints. So that would be gout, it would be arthritis, also a sore back, an inflamed back. Now when someone's got an inflamed back, they usually put a hot water bottle on it, is that right? But if the back is hurting because of inflammation, where's my knife? Here. The hot water bottle will relax, and you know the reason why the hot water bottle relaxes is because when we're in pain, the muscles around that area tighten and cramp. Basically, they go out in sympathy with the pain. And you put a hot water bottle on that and it relaxes those cramping muscles. So you do get some relief, but it does not help the inflammation. It can even make it worse. But ginger, if you apply a ginger poultice anywhere where there's inflammation, the ginger pulls the inflammation out of the joint to the skin and the skin gets really hot. So if you apply this to the lower back, the heat relaxes the muscles, and yet the ginger is reducing the inflammation.
To prepare a ginger poultice, fresh ginger root is typically grated or finely chopped to enhance its release of essential oils and active compounds. The ginger is then combined with a binding agent such as warm water, vinegar, or even a small amount of flour to create a paste. This paste is applied directly to the affected area, covered with a cloth or bandage to secure it in place. Dr. O'Neill notes that the heat generated from the poultice helps to increase blood flow to the area, further supporting the reduction of inflammation and pain. The capability of ginger poultices in reducing joint pain comes from the rich presence of antioxidants in ginger, which combat oxidative stress contributing to inflammation. Using ginger poultices can provide targeted relief by decreasing swelling and pain from conditions like arthritis or bursitis. Dr. O'Neill recommends leaving the poultice on for 20 to 30 minutes to let the ginger's active compounds fully penetrate the skin and work effectively. In clinical and anecdotal evidence, patients have reported significant relief from symptoms following regular use of ginger poultices. Dr. O'Neill points out that ginger poultices can be combined with other natural remedies and lifestyle changes for a thorough approach to managing joint pain. If you start using poultices with diet changes and physical changes, this activity can lead to more significant and lasting improvements in joint health. Using ginger poultices is a practical, non-invasive method that fits with Dr. O'Neill's holistic health principles. Plus, ginger is also great for the vocal cords and vocal strain. It utilizes ginger's natural anti-inflammatory properties to effectively manage joint pain, making it a valuable part of a wellness routine aimed at reducing inflammation and improving joint function. Now we will talk about garlic. Garlic is extensively recognized in both traditional and contemporary medicine for its potent natural antibiotic, antiviral, and antifungal properties. According to Dr. Barbara O'Neill, garlic's therapeutic process stems largely from its rich content of sulfur compounds, such as allicin, which are activated when garlic is crushed or chopped. Allicin, a key bioactive compound in garlic, has a wide range of antimicrobial effects and effectively fights different pathogens. Garlic's antibiotic capabilities are attributed to its ability to inhibit the growth of bacteria. Allicin disrupts bacterial cell membranes, impairs protein synthesis, and inhibits key enzymes crucial for bacterial survival, such as DNA gyrase and RNA polymerase. Research highlights garlic's effectiveness against a range of bacteria, including antibiotic-resistant strains like MRSA, methicillin-resistant Staphylococcus aureus. Its application in managing bacterial infections extends to common ailments such as respiratory infections and gastrointestinal disturbances.
One lady heard about garlic on the bottom of the foot and she grated it up, put it on the baby's foot. Oh, she said, yes, I have a great big blister on the baby's foot now. But if you slice it like that, little by little, the garlic eases in through the pores on the bottom of the feet. And the garlic knows where to go. It'll go to the chest or it'll go to the sinus areas, and it can bring relief. It can even help to break up congestion in the chest. So my son James, when he was a little boy, he used to get a lot of chest colds. And I would put this on the bottom of his feet. He was about 2 and 3. And I'd put a sock on and I'd shoe on and I'd send him off to play. And every step he's taking, what's happening? The garlic's going into his body. You can smell the garlic on their breath within a few minutes. At the end of the day, when I'd take James' shoes and socks off and I'd undo the bandage, the garlic looked like a bit of dried out piece of yellow leather. No juice left. It's all gone into James.
In terms of antiviral properties, garlic can control immune responses and directly resist viral infection. Allicin and other garlic-derived compounds enhance the production of antiviral proteins and support immune cell activity, which strengthens the body's defense against viruses such as influenza and the common cold. Garlic's impact on viral infections is further evidenced by its role in reducing the severity and duration of these illnesses. Garlic's antifungal action is attributed to its ability to disrupt fungal cell membranes and inhibit the synthesis of ergosterol, an essential component of fungal cell membranes. This mechanism targets a wide array of fungi, including Candida species responsible for yeast infections and dermatophytes that cause skin infections. Clinical studies support garlic's effectiveness in treating fungal infections, emphasizing its role as a natural adjunct to conventional antifungal therapies. Dr. Barbara O'Neill emphasizes the importance of fresh, raw garlic for maximum therapeutic benefit, as the process of cooking can diminish allicin's potency. Furthermore, garlic supplements are available, though their efficiency can vary based on processing methods and allicin content. Consuming garlic in its raw form, or as part of a daily diet, is recommended to get its full antimicrobial potential. Garlic's diverse antimicrobial properties make it a valuable part of natural medicine. It complements conventional treatments and supports overall health and wellness. Finally, Dr. Barbara O'Neill gives a lot of importance to the therapeutic benefits of alternating hot and cold water treatments for improving circulation and reducing inflammation.
One of the most powerful immune system boosters is this system here, the hot and colds. So what I'm suggesting is after your hot shower, you have a quick cold. Now you can have a 10-minute hot shower and a 10 seconds cold. Aren't you glad I didn't say 10 minutes cold and 10 seconds hot? It's all relative, isn't it? And if you go like this, don't worry about that. Cold is an excellent tonic. Every morning at Misty Mountain Health Retreat, I do my high intensity exercise, running up the hills, walking down them, running up. The hat came off, the gloves came off, the whole body warms up. And I really missed diving in my mountain stream this morning. So even in the middle of winter, I dive in my mountain stream. And it's one of the most powerful immune system boosters, that quick cold. Now, because it's quick, it gives a rush to the body and it basically stimulates the bone marrow to make more white blood cells.
Her approach, rooted in hydrotherapy, uses the thermal properties of water to stimulate beneficial physiological responses for health. Hot water treatments, typically administered through hot baths, showers, or compresses, induce vasodilation, which expands blood vessels and promotes increased blood flow to the affected areas. This expansion enhances the delivery of oxygen and nutrients while facilitating the removal of metabolic waste products from tissues. The heat also relaxes muscular tension, which can alleviate pain associated with chronic conditions such as arthritis or muscle strains. When it's hot, your body releases endorphins, which are natural painkillers that help reduce pain and make you feel better. Cold water treatments like ice packs or cold baths cause blood vessels to tighten up. This is a bodily process where blood vessels constrict and reduce blood flow to the targeted region. This reduction in circulation helps decrease swelling and inflammation, making it especially effective for managing acute injuries or flare-ups of inflammatory conditions. Cold therapy also numbs the area, offering temporary pain relief by decreasing nerve sensitivity. The decrease in metabolic rate and enzymatic activity also helps limit tissue damage and speed up recovery. If you start using a contrast bath regimen, where you switch between hot and cold water, it combines the benefits of both treatments. This approach can enhance the positive effects of each therapy, providing more comprehensive relief and improvement. This technique improves blood flow and reduces inflammation by using the vascular pump. The hot and cold water alternately cause your blood vessels to expand and contract rhythmically, which helps with circulation and inflammation. This dynamic movement aids in the effective clearing of metabolic waste products and promotes faster healing. Additionally, contrast therapy helps in balancing the autonomic nervous system, which can improve overall stress resilience and contribute to better health outcomes. Dr. O'Neill advises that water treatments should be customized to each person's tolerance and health conditions. For example, people with heart issues or specific skin conditions should talk to a healthcare provider before starting hydrotherapy. The timing and frequency of hot and cold treatments should be adapted based on how your body responds and your therapy goals. Regularly using these treatments can help improve circulation and reduce inflammation by taking advantage of temperature changes. So, what do you think about Barbara O'Neill's natural healing techniques? Have you tried any of them yourself? Let us know in the comments below. Don't forget to like, subscribe, and hit the bell icon for more eye-opening content. And if you also want to know about some more miraculous remedies that beat traditional medicine at every step, just click on this video.